Hello, everyone. Welcome back to St. Louis Teens. I'm here today with Bishop Robinson, who is the director for St. Louis STL Hope, which is a collection of three shelters helping the unhoused in the St. Louis area. Um, Good morning, Bishop. How are you today?
I'm great,
Uh,
Shree. Good to be with you, man.
yeah, thank you so much for willing to interview us and help us understand what you're going through as trying to help those who are unhoused and currently within these shelters within the midst of the coronavirus outbreak.
Yeah, uh, I appreciate you for certainly wanting to know more about it and helping to bring more attention and awareness to what's going on. Thank you.
Yeah. So, firstly, because of the current coronavirus outbreak, are there any additional measures you're taking at STL Hope shelters in order to help out the people who are currently there, in if they were to get the coronavirus and to prevent such coronaviruses from coming into the shelters?
Yeah, man. So we have, boy, we've been on the phone all week long and in meetings all week. Just trying to get all of our ducks in a row, as to say,
Yeah.
and come up with plans, contingency plans for what we would do in case of a major outbreak that happened amongst the unhoused community members or within the shelters. Certainly, we are taking the precautions that have been prescribed by the CDC and the WHO in order to ensure that all sorts of safety measures are in place. We have done a deep cleanse on all of our facilities because right now here, City Hope shelters are on standby. Um,
Okay.
Anytime the weather is 32 degrees or below, we are activated. So we have to be ready at any point. So we've done a deep cleansing at all facilities. We are asking community members and supporters to donate hand soap and paper towels and toilet tissue and sanitizer and things like that, so that each facility, and of course, the hard to get Lysol. You can't find it anywhere
Yeah.
right now, but we're asking for all of those things.
So are you sort of, as the director of these shelters, are you being offered guidance by, any professional organizations beyond just what the CDC has sort of publicly published?
Yes. In St. Louis, the way our health department is, the Department of Health is. It oversees the Human Service Division, which uh, the homeless shelters are up under that. And so we receive instructions and have been receiving instructions directly from the head of the health department for the city of St. Louis. They are giving us the guidance and we're following their prescribed methods.
And so are you getting the answers which are able to help you? And are you getting informative answers which are sort of able to guide you in, what future steps, you can be taking?
Yeah, they really are doing an excellent job, and I'm really excited that our city is taking a proactive approach. Our health department is taking a proactive approach to this. I'm proud to say that they have taken measures to proactively uh, find out what could happen if the unhoused community members have this and other questions. So they have really been taking a proactive approach to it, and I'm grateful for that.
And, sort of looking to this unhoused community, there have been, various rumors, from people who have been tested or people who are going to be tested that, that their insurance may not necessarily cover the coronavirus testing. And so even if they were admitted to the hospital, their insurance may or may not cover it. But, for those people who may not even have that, backup, for those who are uninsured, have there been any specific plans or contingency plans for them to help them?
Not that I am aware of at this time. However, we are lobbying for those sorts of things to be leveled out, where they, if anyone comes into any health facility, whether they're insured or not, if they're exhibiting the symptoms, we're lobbying that they be taken care of, that they be tested immediately. Um, it's one of those things where our unhoused community members are deeply concerned. They're like, I don't have any money to go and get tested,
Yeah.
but we want to make sure that they have the reassurance of knowing that, hey, if you're sick, if you have these symptoms, let's get you to a place where you can get help.
And sort of, continuing on that, or do you have any, advice for the unhoused who are seeking shelter, during this time?
Yeah. So right now, if you are, there's certainly various methods that you can go through. Certainly, you want to use the city's 211 hotline and give a call there to find out what may be available that night. You can always go to our social media pages, City Hope, and you can leave us direct messages on City Hope STL, and we'll let you know what shelters are available um, that we have. There's also Biddle House. There's also Gateway 180 for women, children, and families. You have those different options where you can go. Covenant House,
Yeah.
Peter and Paul. Give those other places options as well. I use those as options.
And sort of, looking at, the populace that you're able to serve, have there been, if there have been questions, what are those questions that you have been receiving from the unhoused that you're serving and the volunteers and staff, at these shelters as well?
Yeah, volunteers are asking questions like, can we continue to bring food? Can we continue to volunteer?
Right.
Will we be allowed in? I know that there's one shelter that I heard from today. They're not able to receive any outside food donations, and
Really?
they're not allowing any volunteers within. That is causing a huge strain upon their paid staff. And I don't foresee City Hope doing that. We need all of the support we can get.
Yeah.
So we're just going to ask that if you come, that you come and you're not sick.
Yeah.
You're not exhibiting any of those symptoms, coughing, fever, respiratory issues, things like that. We want to make sure that we keep everyone safe, exercising universal precautions, social distancing. In some of our shelters, one of the things that we're doing, Street, is we hate to do it, but we're going to eliminate a few beds in
Okay.
order to keep an adequate amount of
Just,
space in between,
yeah.
at least 6 feet in between each cot that's there.
Right. And sort of, tagging on to that, what are your concerns moving forward and, moving forward into the future, of how this may affect the people that you're serving?
Well, certainly it is putting an economic strain on our entire nation. We see from going into grocery stores that many of the shelves are barren now, and
Yeah.
we know that that has a trickle down effect, and those things can end up causing some great challenges for those that are unhoused.
Yeah.
We can see a significant number of new unhoused cases come about because some individuals are not going to be able to work. We have to look at that when these places are closing, schools are closing, stores are closing, all of this, there are people that are not going to receive income as a result of this.
Right.
They could lose their housing. So we have to be on standby and ready to assist those that may have those challenges.
And sort of, continuing on that, of how we can assist, these people who do need it, what can we do as a community, to help support your efforts?
Well, certainly you can always make your donations to the whether it's monetary or food or supplies, you can make any type of donation there. It would be greatly appreciated and put to good use as we work to keep our unhoused community members safe. We certainly, that tight-knit community of unhoused friends, they're very close to one another, and they're willing to share a lot with one another, and we don't want them sharing the virus. So we want to make sure that we're doing our best to help them to stay safe.
All right. Well, I wish you the best of luck with this, and I hope that your shelters are able to adequately handle it and be healthy into the future.
Yes, sir. We thank you for your help.
All right,
Thank you
well,
for your help and support.
all right. Well, thank you so much for your time.
All right. Have a great day.
You too.